Good morning. Thank you all for joining us today. We're joined today by representatives from University of Rochester Medical Center, Rochester Regional Health, and Dr. Michael Mendoza from the Monroe County Department of Health. This has been an incredibly long 9 months for our community and for our nation. But today is a monumental day in our fight against COVID-19 pandemic. Today is the day that many of us will remember for the rest of our lives, because today is the day that we can talk about the arrival of the COVID-19 vaccination here in Monroe County. Over the course of the last 9 months, we've come together in ways like never before, breaking down silos, bridging gaps, and protecting, all in the interest of protecting public health of our community. Our two hospital systems, Rochester Regional Health, the University of Rochester Medical Center, and of course, Dr. Mendoza and his incredible team who've been working 24/7 at the Monroe County Department of Public Health, have helped lead the way and are once again at the forefront of our efforts to address COVID-19. While we can celebrate the arrival of the first doses of the vaccine, we all need to remember that this is going to be a long and thorough process. We are still months away from a wider distribution to the community. This is the time to understand that if you have questions about the vaccine, now is the time to ask them. The only way we are going to get through this together is by asking questions, sharing information, and working together to improve education around the virus and the treatment. We need to operate in facts during this time. We need to share information, not theories or in misinformation. We need to share information from reliable sources, not speculation or rumor. This is one of the largest public health undertakings in the history of our community, in the history of our nation. We know that the vaccine is our best weapon against COVID-19 and the way that we know we can ultimately end this pandemic next year. But in the meantime, we still do have another weapon, and that is all of you. That is continuing to do what we know works to flatten the curve, and that is to utilize all of those tools at our disposal. We need to wear our mask. We need to keep a good physical distance, and we need to do and recognize all the other measures that we have grown accustomed to over the last 9 months and that we know works. We all have a role to play in how this ends. We see where the ending is. We see the light at the end of the tunnel. Today, I've said this 100 times, but today is the day not to give up and not to just think the magical cure is here, but today is the day to double down our efforts, to do our part, to help the hospital system, to help the doctors who are going to talk today about the vaccine. It's to help them get to that point where the vaccine is more widely distributed and we can get through this pandemic together, just as we've been addressing it together this whole time. In the coming days, we will be announcing our plans to ensure that the principles of fairness, equity, and transparency and the delivery of the vaccine to this community are addressed. We are here to work with everyone and want to ensure that the questions that you have are answered and information is shared when we have it. I want to thank all the scientists and medical professionals who have worked so hard to make this day a reality. Today is the day to all band together to slow the spread of the virus so that our hospital systems do not become overwhelmed. They can manage the spread of the disease, they can manage what comes into the system, they can manage the distribution of the vaccines to our community so that in the coming days and weeks, all of their efforts can continue uninterrupted. I'm now going to hand this over to Dr. Michael Mendoza, and we can learn more about what the vaccine means here for Monroe County, our hospital systems, and can answer any of your questions. Thank you.
Thank you, County Executive Bello, and I want to echo your sentiments that today is indeed a very exciting day for our community. We have been through a long 9 months together here in Monroe County. We've learned about this virus, we've learned about how it's transmitted in our community. Thousands have become ill, and we have unfortunately lost far too many people in our community, neighbors, friends, relatives, and loved ones. We owe it to them to turn the page. And today represents the day that we turn the page into a new chapter here in Monroe County in our fight against the COVID-19 pandemic. We now have a safe and effective vaccine against COVID-19. It has been vetted, it has been studied, it has gone through a very rigorous process The process, I will say, is probably in some ways more rigorous than in general, given all of the acuities around this crisis, urgency to get it done and to get it done right. This virus is the last thing we want to see in 2021, and the way we get beyond this pandemic is by achieving immunity at a community level, and the best and most safe way to do that is through vaccination. As a member of the Highland Hospital medical staff, I've been selected randomly to begin my process for getting the immunization, and so I will be getting my immunization tomorrow morning. But at the same time, there's still a lot of uncertainty around this virus, and rightfully so. It has come out relatively quickly, quicker than any other vaccine in the history of vaccines. There are many legitimate questions. Many communities in Monroe County and in Rochester have a very legitimate and valid reason to question and to be suspicious of this vaccine. So before we can even talk about herd immunity and getting to the point where over 75% of our community is vaccinated, we need to do our part as a community to ask these questions, to answer these questions, and to create a space that's safe for us to engage in a dialogue so that we can get to the point where enough of us is vaccinated in order to get past this pandemic. So how do we do that? Well, we do this by not reinventing the wheel. We got to this point because of conversation, because of collaboration, and because of cooperation across our community. We need to do that again. We got here by looking at the data, by following the science, by looking at the evidence, and we need to do that again. We also got here because we learned some very important lessons. The first of which is that this pandemic impacts communities of color in a disproportionate way. And we need to remember that as we develop our plans to distribute this vaccine across our community. So while there's a lot left to go, and while we will again continue to ask for your patience through this pandemic, we are on the way toward getting beyond the pandemic of COVID-19. So with that, I will turn it back over to Steve and the county executive for questions. I'm sorry. Before we do that, I'm going to hand it over to Dr. Michael Apostol to speak on behalf of UR Medicine and their efforts for the COVID-19 vaccine.
Thank you, County Executive Bello and Dr. Mendoza. I'd also like to thank my colleague, Rob Mayo from Rochester Regional, who's also on the call. I would like to make a few brief comments. First, I can confirm some very welcome news. An initial shipment of Pfizer-BioNTech vaccine has arrived at Strong Memorial Hospital. And late yesterday, we were able to vaccinate 10 employees at Strong. For security reasons, none of the institutions involved in the New York State vaccination program are able to say exactly how much vaccine they receive, when it arrives, or where it is located. However, our communications team recorded video of the shipment's arrival at Strong, which was the first vaccine to arrive in Rochester. We will share that video during this briefing, along with some video and still images of the first employees to be vaccinated. For the record, the very first person in Rochester to receive COVID vaccine outside of a clinical trial is Mr. Carlos Rosa. That's C-A-R-L-O-S, last name Rosa, R-O-S-A. He works in patient transport and supports hospital units at Strong that treat COVID-19 patients. The video we are sharing includes comments from Mr. Rosa and some of the other hospital staff members who were vaccinated yesterday. Another small group of employees will be vaccinated at Strong today, and beginning Wednesday, we will open a clinic that will vaccinate about 200 persons every 4 hours. I should note that we surveyed more than 10,000 employees yesterday about their interest in being vaccinated. 60% said they would like to participate with vaccination as soon as possible, and 27% said they were unsure at this time. Only 13% said they were not ready to be vaccinated at this time, and we are hoping as more employees are vaccinated, that they will see how their colleagues are doing and agree to be vaccinated. It brings me great pleasure to make this announcement for several reasons. First, is that the Pfizer vaccine has proven safe and effective in rigorous scientific trials involving tens of thousands of persons. As we are able to offer vaccine to more staff members and ultimately patients, they will have 95% protection against being infected with COVID-19. Second is that we were able to announce this news with County Executive Bello, Commissioner Mendoza, and Dr. Mayo from Rochester Regional Health. The UR Medicine team has worked closely with their teams and with our state and local officials to coordinate every aspect of our health system's response to the pandemic. We've had to share a fair amount of difficult news over the past 9 to 10 months, and I'm delighted to join with them in sharing this great news for our community. Third is that there is more good news to come. We expect to receive additional shipments of Pfizer vaccine and Moderna vaccine in the coming weeks, which is also proven safe and effective. As I said last week, hope for an end to this pandemic is on the horizon. Thank you, and I'll turn it over to Dr. Rob Mayo from Rochester Regional Health.
Thank you, Dr. Apostolakis. Great to be here with you today and with Dr. Mendoza and County Executive Adam Bello. This is such a celebratory day. What a wonderful moment in our experience with this pandemic. I do believe today will be changing our future significantly. It's wonderful to know that some of the scientists who designed and have overseen the Pfizer research that has demonstrated that this vaccine works live and work here in Rochester in our hospitals. We've actually had members of our community who have received this vaccine over the previous several months. So we have a wonderful initial view and can also take pride in the fact that our leaders in this community have contributed to a worldwide vaccine that will change the course of this pandemic. Out of pride for their work and out of respect for those who have suffered through this pandemic, it is fitting for all of us to consider carefully how we want to participate in the vaccine and vaccine clinics. I'm glad to share with you that Rochester Regional Health has also received vaccine in our order from Pfizer, and we will begin today to vaccinate a small number of individuals and then ramp up the volume of our vaccine clinics into the hundreds a day later this week. We will be receiving additional vaccines shipments from Pfizer and also look forward to the anticipated emergency use authorization for the Moderna vaccine and other potential vaccines down the road. We are all in this together, and I hope that all the members of this community will seriously consider participating in the vaccine when their turn is available. Thank you very much, and I'll turn it back to Dr. Mendoza.
All right, great. Thank you. I'll just start by thanking you, Dr. Mayo. Thank you, Dr. Mendoza. And thank you, Dr. Apostolakis, for your partnership and work and collaboration on behalf of this entire community that has gotten us here to this point. I'm just so delighted that you've all come together to work together facing a pandemic that has impacted us across the community here. So I do want to say, before we open up to questions, I do want to also thank Morgan and Will, our interpreters who are joining us here today as well. Thank you for getting this information out to the entire community with us as well. So with that, I'm sure you all have a lot of questions for our medical team here. So we'll have Steve open this up.
Thank you, County Executive. Please direct your questions to one of the panelists. First up is Jonathan Hunter from Spectrum News. Hello, Jonathan Hunter from Spectrum News. You have a question? Okay, we'll come back to him. Go to Jane from 13 WAM.
Hi, good morning, everyone. Thank you so much for taking our questions. This is a great day. For the heads of both of the hospitals, can you explain how this rollout is going to happen and how you're going to prioritize who gets the first shots?
Well, I'll respond for UR Medicine. We've been asked and directed by the state Department of Health how to prioritize, and that's based on risk of exposure to COVID-19. So we are looking at our emergency departments, our ICUs, our operating rooms, our floors that take care of COVID patients, and prioritizing all those that work in those units. They'll be the very first to be vaccinated. So if you're working on a COVID floor, if you're operating on COVID patients, if you're taking care of COVID patients in the ICU, no matter whether you're a doctor, nurse, transporter, technician, whatever your role is, you will be given the highest priority. Then other healthcare professionals who may not take care of COVID patients daily will be the next priority, and on down the line till we've completed our healthcare workers. At the same time, as you know, there's priority to those who work in nursing homes and to nursing home patients.
Jane, do you have a follow-up?
I was wondering if Dr. Mayo might be able to address that same question first.
Sure, I'll echo Dr. Apostolakis' comments. Rochester Regional Health is following the New York State COVID-19 vaccination program guidelines. They are built upon the Advisory Committee for Immunization Practices, the ACIP, which is a branch of the CDC. And those ethical and practice principles are built into these guidelines, and so we are certainly following them. So similarly, we will be vaccinating emergency room and ICU environments first, and all individuals who work in those environments will be part of this vaccination process. Maintaining equity and opportunity and access to the vaccine is very important in these clinics, and we want to ensure that that happens for our employees.
And then if I could just follow up, Dr. A, you mentioned the nursing homes. It was my understanding, and maybe that's incorrect, that their doses would be coming through CVS and Walgreens. Is that part of the shipments that you received, or are those entities getting their own shipments? How is that all logistically working out?
They're getting, great question. They're getting their own shipments. However, we're responsible for our staff who practice in those nursing homes. So we will be vaccinating our medical attendings who take care of patients there. But you're absolutely right. They get their own shipments and will be administering through the pharmacies, as you said.
And I'm sorry, just one quick follow-up so I'm understanding. How quickly do you think you will have enough doses, both gentlemen, to cover those people in those priority levels that you just spoke about?
That's a great question. We are getting information about what we're receiving on a weekly basis. And so I hate to project too far into the future, but I'm hopeful that we'll be able to get through the highest, certainly by the end of January would be my hope.
Yeah, there is a fair bit of uncertainty still regarding the timing and the volume of shipments. So we are coordinating with those entities as ably as we can. And so we look forward to moving this quickly, and our promise to our employees and to this community is that vaccine will not be waiting when it arrives. We will be acting quickly and distributing it as we receive it.
Thank you both.
Hello, this is Jonathan at Spectrum. I think my microphone's on, so it's okay if I ask a question. So my question would be, I guess, for Dr. Mayo and Dr. Michael Apostolakis. Talking about the timetable of getting this vaccine out to the public. I mean, obviously the first step is getting the healthcare providers taken care of first, but do you guys have an estimate or a plan of rolling this out to the general public?
We do have plans in development for that. We certainly want to be part of that community solution and partner with all of the institutions that will be extending vaccine. So similar to the rollout within healthcare workers, we will be looking at our patients, those who are in most need initially, those who are most vulnerable because of their unique disease states. And then we will create a prioritization with them, and then we'll be extending this through our clinics. So that's work that's in place, and we're not sure exactly when all the vaccine will be available for us to offer that, but we hope that in the coming weeks and that we'll be well on our way to vaccinating our community.
Yes, and I would just like to echo what Dr. Mayo said. We're working closely with state, local government, county executive, and Dr. Mendoza, as well as RHS, to plan for the community. And getting through the employees is one step, but at the healthcare systems, but we need to assist with the community in making sure vaccine is spread equally and equitably throughout the system. But getting to the community is going to be even more complex than taking care and vaccinating our employees. But we're up for the challenge, and we're going to work closely, and we'll get it done.
Jonathan, do you have a follow-up?
Yes, and just talking about, I guess, the concerns that you guys have of, people being hesitant to take it. Like you mentioned earlier that there were some people in the healthcare profession who were concerned about taking it, talking about the concern about making sure that communicating to everyone that it is safe.
Yeah, that's a great question. And as was brought up earlier, there is concern because this is a vaccine that came to market very quickly. However, I don't believe that any other, and in fact, I can say no other vaccine in history has been given this much attention or this much work. And it wasn't that corners were cut with developing the vaccine. It was just so much more effort was made to do all the steps in a very concise way that enabled us to get this out. And I think it's a modern miracle of the 2020. This couldn't have happened in 1920, but we're able to get it out. It's safe and effective, and we're going to encourage people to take it. I'm hopeful as people see patients who take it and are having minimal, if any, side effects, that more and more will be encouraged to take it.
Yes, I do.
Next, we have Randy Gordman from WXXI.
Yeah, just in general, I mean, you addressed this to some extent, but I guess just asking maybe Dr. Mendoza, unless somebody else wants to chime in. I know there's concern about getting this out to the community, especially communities of color, and that's been a big emphasis of the governor. I know there's direction from the state health department, but Dr. Mendoza, how does the county fit into that? What kinds of priorities and what kinds of initiatives will you take, the county take to get it into communities where people may not have easy access to doctors?
Well, I think it comes back to what I said earlier, which is that we have to make sure that we build on what we've already been working on to date. That we've been following the data, following the science is critical, but not enough. We need to be aware that many in our community still have questions, and many are rightfully confused. This process has unfolded much more quickly than any other process like it in the history of public health. And I get that. I think people who have questions have a good reason for questions. And our job in the health department has always been to educate and to support and to coach people so that they can make the most effective health-oriented decision for themselves. And so I don't take it for granted that everybody's going to want to get this vaccine right away. I think we need to earn that trust, and we need to build on what we've done today. And that means reaching into all of the communities in our county, inviting them to ask questions, inviting them to share with us those things that they're uncertain about, and giving us the responsibility to answer those questions truthfully and with transparency. And so thankfully, we don't have to get everybody vaccinated right away. We have some time, but I don't want to take too much time. And so this is going to be a huge priority for the health department. And we will be sharing more about our work in this realm in the coming days.
Okay, so, and again, I realize this is still not fully formed, but I mean, can you see the county, either you or or County Executive Bello, actually having the county go out and doing vaccinations in various parts of the city, let's say?
Well, so those are details that we're still developing. You know, in the early phases of the vaccine administration program, you know, we have to work out all of the logistics of actually giving the vaccine. And so, you know, initially we're going to be giving them in healthcare settings because we want to make sure that if there are, you know, mild complications and so forth, that we would be in the right setting to manage those. And this is true for any vaccine that we would give. And so once we gain experience in that way, and once we learn about all the particulars about how to store it and transport it and so forth, our goal be that we have to find ways to administer this in the community, because there's no way we're going to administer a community of our size solely within the walls of hospitals. So we'll be working with primary care offices, other ambulatory settings, and then eventually in the community. If we can find ways to do so safely and effectively, absolutely. We'll need to make sure that we bring this vaccine to the community and or bring the community to the vaccine. But we simply just can't expect it to happen. We have to work for it.
Thank you.
Great. Thanks, Randy. Next, we have Collins from WROC.
Good morning, Atia Collins here with Channel 8. Thank you guys for taking my question. My question is also about nursing homes, and you just kind of touched on it right there, Dr. Mendoza. But as far as storing and transportation with this vaccine, with such the tight turnaround of when it's taken out of the freezer and when it needs to be administered, how will you get it to people in nursing homes where there'll be a clinic inside? Will you kind of have to drive the vaccine within a certain time period? I'm just wondering kind of how it will all operate to keep it safe and make sure the vaccine is still viable.
So I'm going to hand this one over to Dr. Apostolakis or Dr. Mayo, because I know that you've been, I think, working on this. Is that a fair assumption?
Yeah, sure. I can start. Specifically for the nursing homes, because that will be managed through the large pharmacy partnership, I can't speak to their process, but I imagine it will be similar to what we're using for our hospital employees and then subsequently for our patients. But there is a very prescribed process for thawing the vaccine, the time that it takes, diluting it, drawing it up, and administering it. And you're right, time really does matter. The vaccine will be very carefully handled. We have training programs for those people running those clinics, and we are scheduling our employees so that we have the right match between vaccine volume and recipients of the vaccine, right? So all those processes are being carefully designed and are now ready to go forward.
Yeah, I don't really have anything to add to what Dr. Mayo said. We're following the prescribed way of handling the vaccine and training many members of teams to be able to facilitate vaccination as quickly as we possibly can. And similar processes are being undergone by the pharmacies who are handling the administration for the nursing homes.
And then my follow-up question is for Mr. Bello. As far as resources, funding, making sure the county and any of the hospital systems have enough to push out this process, are we where we need to be? Are we reaching out for state for funding, or just talk to me about the resource aspect of it?
Yeah, it's a couple different approaches here. First is that over the last couple of weeks, and with the growing number of cases that we've been reporting every day, and make sure we can stay on top of the investigations, along also with the rapid testing community sites that have been stood up. We've been staffing up here in our Department of Efforts with 150 new COVID, we call them COVID clerks, with 150 new staff people have been are in the process of being brought on board. And so it's to handle those initial onslaught of cases, but then also to be able to supplement and fit into the growing vaccination program as the need shifts. And so we've been able to bring folks on board to do that. The second piece, though, is that we continue to advocate to our federal partners the need for help from the federal government. Last year, we were the beneficiaries of CARES Act dollars that went out across the country. We need another stimulus package, though, and another CARES package to be able to continue these efforts to make sure that we can continue to stand up our COVID operations, be able to do everything we can for the vaccine distribution program, and then also to help those who are still struggling in our community. There's a lot of small businesses that are still struggling. People are struggling to stay in their homes that are facing eviction and foreclosure. And we really do need additional support from the federal government. But make no mistake, our response to COVID-19 is first and foremost our top priority here in Monroe County government. So we will continue to put every resource that we can find into that response to make sure that we get this right, because we only have one chance at this. This vaccine, it's here today in limited quantities. It will be coming over time in different quantities over the next several months, and we need to work together and put every resource we can find and getting this done the right way.
Thanks.
Next, we have Patty Singer from the Minority Reporter.
Hello. How long will it take for immunity to be effective with the 2 doses that are needed, and how is that going to be communicated to the public that the vaccine actually is effective now that it is going to be in a large number of people?
I'll let one of the doctors speak to that.
Okay. Well, excuse me. The initial data suggests that you begin to get some immunity 10 days after the vaccine. Once again, this is a 2-step vaccine that's 21 days apart. But generally, after the second dose, 10 days after, you're felt to be protected. However, the data is very good at showing it prevents clinical disease and it prevents severe disease. We believe that it likely inhibits transmission from person to person, but that is yet to be proven. And as such, no matter whether a person's vaccinated or not, for the time being, we are encouraging the community and those vaccinated to stay masked, stay socially distanced, and to keep your hands clean. We're going to be recommending that for some months to come. And as we build up this herd immunity of people that are vaccinated, at some point, months down the road, we can begin to talk about eliminating those things. But for right now, the public just needs to know that they need to continue to mask and to socially distance. And the vaccine, although effective in getting the disease, the illness, and effective in getting preventing severe disease, we still don't know how well it inhibits transmission.
To that, this may come to the county executive. So with the nursing distribution to the nursing homes being done by third parties, what will the county be doing to make sure there is equity, particularly I'm thinking of in homes that take Medicaid first patients as opposed to private pay that affect a lot of the minority population? How can the county make sure that those homes are treated as equally as the private pay homes are in town?
Right. Well, this goes back to the partnership that we've developed over the year, working together with nursing homes under the leadership of Common Ground Health and Dr. Mendoza. And we're going to continue that partnership. And in the coming days, we'll be talking about different collaborations and partnerships that are going to come together to ensure that. So I go back to what I said before. We need what the county will be engaged in, and where we play a significant role in this, is on making sure that those principles of fairness, equity, and transparency are followed at each step of the way. We're going to play a role in making sure that happens. Most of many of the local nursing homes have signed up through those federal partnerships, including Monroe Community Hospital, to begin receiving those. And so we're gonna be working with them to make sure that that happens, and that's something that we'll be talking more about in the coming days.
And I'll just add to that, the long-term care task force that I convened back in April will be a primary vehicle for us to monitor the equity of distribution of the vaccine in the nursing homes and adult care facilities and assisted living facilities, as well as between them. So there's more to come on that, but we'll be following the data as we have all along.
Mm-hmm.
Thank you.
Okay, thanks, Patty. Next, we have Berkeley Breen from News 10.
Okay, thank you. Excuse me one moment. When you get your high-risk staff vaccinated and the patients vaccinated, will you open up the hospitals to visitors?
Well, right now, the hospital visitation restrictions are related to the levels of COVID positive patients. So I can't say that that restriction would be linked to vaccination rates, since that would be changing how that decision has been guided over the last several months. So, but you raise an interesting point, and I understand what you're saying about the power of the vaccine, and we'll keep you updated. We'll continue that dialogue actively with our state leaders as well as our county leaders, and in the partnership with UR Medicine, we'll come forward with the right relaxation of visitor restrictions at the right time, and I can assure you we are eager to invite visitors back into our facilities. We know what a hardship this is for patients and their families.
Yeah, there's two levels of answers for that question. First is right now we're under the governor's executive order. We're in an orange setting. We're orange designated area, which means if we've had any staff that turned positive in the last 2 weeks, we must keep visitation to the bare minimum. If that changes and we become, we get out of the orange designation, then we do have a choice as a healthcare system to see if patients, family pose a risk. And in general, we've found that patients' families obey the rules. They wear their masks, they stay socially distanced from staff and healthcare workers, and I think pose a relatively small risk. But right now, that's even a risk we can't take, and there is a governor's order at this point that we cannot change. With vaccination, we hope that the rates fall and that we get out of the orange designation, and then we can, as Dr. Mayo said, talk about reinstituting visitation.
Thank you, doctors. When will the average person, when can the average person expect to get his or her first shot?
That's also a great question, and it really depends on supply. My educated answer to that is I believe sometime between June and August of this year. I believe we'll get enough supply that will get through the healthcare workers, get through the patients with comorbid conditions, we'll get through the nursing homes and the nursing home staff. And I'm hopeful by sometime in June, July, or August that we'll be able to offer it to the public. But that really depends on supply and a lot of things we can't control.
Okay, thank you, Berkeley. Next up is Sean Lehman from the Rochester Democrat and Chronicle.
Yes, I want to go back to, we talked about priority one individuals. Can you give me a sense, I'll direct this to Dr. Mendoza, give me a sense for how many people locally fall into that category, and do we have a good sense for how long it's going to take to get vaccines to those people?
Our best estimate is that there are about 50,000 Monroe County residents who fall within that tier 1. And so that's healthcare workers in patient care settings, and you heard the examples of those earlier, long-term care facility workers and residents, and that makes up, we believe, about 50,000. And EMS is included in tier 1. And so, again, it depends on supply. It depends on our ability to administer the vaccine, which I actually don't think will be a limiting factor. And it will also depend upon everybody's willingness and level of understanding about the vaccine. You know, just because we have the vaccine and just because we have the ability to deliver it, it doesn't actually count until somebody gets the vaccine. And so, as I've said before, we've got to do our homework to make sure that everybody who is eligible has their concerns sufficiently addressed to the point that they're comfortable and are getting the vaccine. And so all of these questions about how quickly can we do X heavily rely on our ability as a community to work together, to answer our questions, to allay our confusion, and to get the job done. And so let's not just focus on the operations and the logistics, let's also focus on people's willingness and understanding and level of comfort.
Thank you, Dr. Mendoza. And so in general, the plan is to complete offering the vaccines to those people in priority 1 before the in priority 2 are going to receive that?
That's the general spirit of this. I think in practice, you know, within each of the tiers, there's multiple categories, and a lot of it's going to come down to, you know, details of operations and so forth. But the general spirit is to vaccinate those who are at most high risk first, either from acquiring it or from transmitting it standpoint, and then we go through the subsequent tiers. So, you know, there may be some, you know, shuffling within the tiers a little bit, and there may be, you know, we want to keep, you know, the tiers, you know, relatively distinct. But, you know, down the road, when we're into tier 2, for example, there will likely be people in tier 1 who have not gotten the vaccine, and so we'll go back and accommodate them and so forth. But the general spirit here is to follow the tiers as they've been published.
Gotcha. And just to follow what Dr. Apostolic has said, is Dr. Mendoza, your sense too is that it'll be third quarter probably before members of the general public are going to be in line to get this vaccine?
Yeah, again, it's an educated guess. I think, you know, the summer is I'm hopeful for the summer. I'd like to see us this time next year doing what we normally do in December. But I think realistically the summer is a good aim. But again, you know, we can't just, you know, rest on our laurels and assume it's going to get done. We've got to earn it. We've got to work together. And if we can do that, maybe even sooner. But I think realistically sometime in the summer.
All right. Thank you.
Okay, I believe that was everybody. I want to just thank again members of the media today. I want to thank Dr. Apostolakis, Dr. Mayo from Rochester Regional Health, University of Rochester Medical Center, Dr. Mendoza, and your team at the Department of Public Health. And a couple of things that stood out to me today that I just want to reinforce to the community who's watching this at home is that, you know, what's happened today is a step in the first day in what's going to be a process. COVID-19 is still here. It's still impacting our families. We still have hundreds of people in the hospital system. We're still losing loved ones every day in this fight. And we need to now understand we do have now another arrow in our quiver. We have another weapon to fight it with. But today is not the day to stop wearing our masks and say we're done. Today is the day to double down. It's to really put our foot on the gas pedal because we know what it looks like. We now know what the end can be. But as we said, it's still going to take months to get this out to everyone. So the goal is to get there and be as healthy and safe as possible till we get to that point where enough of us have been vaccinated that we can be healthy, safe, and get back to a sense of normalcy. So today's a great day for our community, for our state and our country. Today is a great day for those who have been working so hard to get this vaccine out in record time. And today I think is a good day for our community, because we can see what the future looks like, but we have to get there. We still have to get there. So let's do the right thing. Let's continue to work together. And again, let's thank really all of our healthcare workers who have been working around the clock at all of our hospital systems and healthcare facilities around this community. They are the heroes through this pandemic. We owe them a great debt of gratitude, and they are going to be also the heroes and protectors that get us through the next 6 months too, as we start to vaccinate this community. So let's honor them and their work and sacrifice by doing the right thing and wearing our masks. Thank you, and we look forward to talking to you again soon.
Thank you.